Are you willing to?
Wait a minute. Okay, we are back live. We have a technical glitch.
Meeting.
And but we are live, and this is Senate Health and Welfare, January 24th, and we're going to continue going through some of the reports that we have in committee with Katie McClin and Amran Abajali, and then we'll move on to some updates on workforce. So
that sounds great. So normally I join Zoom to share a document. Alex doesn't know this because he's remote, but we were getting an echo feedback, Alex, when I was muted on Zoom. So I can't share my document. I'm wondering.
Try joining again, and when it gives you the pop-up to join with audio, just exit out of it. Don't select an option.
Okay.
okay, there, that sounds better. Katie, I'll turn it over to you.
Great. Thank you. I'm going to share my screen and pull up that document. Success. Long time coming. So Katie McClin, Office of Legislative Counsel.
Amran Abajali, Legislative Counsel.
And we're basically just doing a continuation of where we left off when we were going through the reports due to the committee.
Can you enlarge that?
Oh, sure.
Please.
In theory, yes. See what happens. Better?
Excellent.
So we weren't entirely sure where we left off, but we think we were around the early childhood exclusionary. What's that?
Yeah, so,
Does that sound about right?
yes.
It's not lining up with my document. Okay, here we are. So we'll give you a pretty high level, and you can see which reports had come in as of the date we prepared this, because those are hyperlinked. So there was a report on early childhood exclusionary practices. This defined suspension, expulsion, and exclusionary practices in an early childhood setting, an early childhood education setting, and practices for supporting children who had been suspended or excluded. And this was coming from both the agencies of education and the Agency of Human Services.
All right, and next we have a series of reports that are all from Act 167 from last year. The first is development of a proposal for a subsequent all-payer model agreement. This is a report from the Green Mountain Care Board and the Director of Healthcare Reform.
We can get this by going to witness name. So if you go to witness, and then you'll see Amran Abajali right at the top, and you click on her, and you'll see the list of reports with her name. So you go to your web page, go to witness, go to Amran Abajali, and then you go to reports. You're good. This is how we navigate. Need a compass.
Next, we have the community engagement process for hospital system transformation. Again, it's part of Act 167. So this is a report where the Green Mountain Care Board develops and conducts a data-informed, patient-focused, community-inclusive engagement process for Vermont's hospitals to reduce inefficiencies, lower costs, improve population health outcomes, reduce health inequities, and increase access to essential services. The next Act 167 report is a blueprint for health per member per month payment increase recommendations. This is going to be coming from the Agency of Human Services and the Director of Healthcare Reform. And then the last Act 167 report is statutory changes needed to align prior authorization processes and requirements across insurers. And that's a report coming from the Department of Financial Regulation.
Those are not out yet.
I should say, so much of the reports in this were due on January 15th, which was over the weekend and then followed by holiday. So there was a lag time in links being available. So just because we don't have the link in here does not mean that it has not been submitted, just that the last time we updated this, which I think was a couple of days after that, we did not see them yet.
Okay.
So we can go through the reports page on the General Assembly website and check, because it's very likely that a majority of these came in and there was a delay in posting them.
Yeah, and there have been some requests for postponing for a month,
Okay.
so some of them won't be in, but they will be in ultimately, like the Health Equity Commission
Right.
report, that's coming in later.
Mhm.
Yeah, so,
We can ask Alex if he'll swap out this document for the document with updated hyperlinks. So
Yeah.
you'll have the most updated version.
Senator,
Share lines, this blueprint here is different from the blueprint that we heard about last
it is the
week.
same blueprint,
It's the same blueprint.
it's the same blueprint.
Okay.
It's just, this is a report about blueprint.
Okay.
So the program you heard about is, that was the global presentation,
Gotcha.
community health teams and how they work.
Okay.
And then the report, in the report, I forget, we asked some very discreet questions
Okay.
legislatively, and then they'll come back
Great.
with that information.
Thank you. Yeah, because
Okay.
blueprints used, we have a blueprint in ed too. So
Yeah, it's
a lot of
ubiquitous, is it
difference.
not? Yeah.
Thank you.
Yeah, so, and when we start looking at any legislation related to Blueprint, we'll go back and look at the report that's come to us.
I can't wait.
I know, it'll be fun.
That'll be fun.
Next are a series of reports resulting from Act 180 from last session, specifically around nursing simulation laboratories. So in Act 180 of 2022, the legislature required Vermont State Colleges, Norwich University, and UVM to submit a report detailing the infrastructure and programming needs, estimated costs, and timeline to renovate or construct nursing simulation laboratories in order to expand student enrollment at nursing programs in the state. So you see, those are those three reports up there, one from Vermont State Colleges, one from Norwich University, and then one from the University of Vermont and Vermont State Colleges. So next we have a couple of reports coming out of Act 183 of 2022. The first one is having to do with nurse preceptors and nursing student clinical placement opportunities. This is from the Agency of Human Services. And this report is supposed to identify ways to increase clinical placement opportunities across a variety of healthcare settings for nursing students enrolled in Vermont nursing school programs. And then the next Act 183 report is coming from the Department of Labor and the Green Mountain Care Board. And this is a report on the process, methodology, and necessary funding amounts to establish and maintain the capacity to perform healthcare supply and demand modeling based on information in the Healthcare Workforce Data Center, which would be for use by healthcare employers, healthcare educators, and policymakers. And then the next Act 183 report is statutory changes needed to align prior authorization requirements across health insurers. And this will be coming from the Department of Financial Regulation and the Green Mountain Care Board.
The next several bills come from the 2021 Budget Act. So the first was a report pertaining to public inebriate and sober bed programming. That report looks at examining capacity and financial stability of programming. The second report has to do with mobile crisis outreach services for individuals in mental health crisis, coming from the Department of Mental Health. Also from the Department of Mental Health is a report looking at the patient experience of care while waiting in emergency departments for treatment or placement. Next is an annual report. This is an evaluation of pre-kindergarten programs throughout the state. That comes from AOE, Agency of Education, and the Department for Children and Families. And there's also an annual report of the Emergency Service Provider Wellness Commission. When we went over the bills that this committee had recently worked on, this was one of the bills creating this large wellness commission for emergency service providers. And they were tasked with doing an annual report on recommendations to the legislature, and that's what this report is.
So next we have the Blueprint for Health Annual Report. That is from the Department of Vermont Health Access. I should say, moving forward, looking at due dates, we are now looking at reports that are due to come in the future for the rest of this year.
Thank you. So one of those reports is an annual report on the Reach Up program. Reach Up is the kind of Vermont lingo, the Vermont title for the TANF program, Temporary Assistance for Needy Families. So that is an annual report. Next, a report is coming from the working group on services for individuals with eating disorders. That's coming on February 1st. And that was a report requested in one of the bills that was worked in by this committee last year.
Yes, ma'am.
Thank you. When we look at, for example, that report, we look at it together in this committee. Or
We
not?
can, and
Okay.
one of the issues that we're hearing about right now is that there's a waiting list for treatment for kids with eating disorders. And so the program is being sort of set up, fit up at the medical center in Burlington. And they're having, some logistical issues with it. So that report will be helpful to us as we look at that issue.
And if we're not looking at it together in here, the onus is on us to do it on
Yes,
our own time.
absolutely.
outside of
And,
committee. Okay.
we can reach out and meet with folks.
Okay.
Thanks. Next is a report coming from the Department of Vermont Health Access on a home and community-based service provider rate study, looking at provider rates for those entities. And
So last year's budget asked for a report on the use of funds appropriated for the designated and specialized service agencies loan repayment and training program. So it's looking at how funds were used for provider loan repayment and tuition assistance.
Yeah, this is a good example of a bill, of a report that will inform what appropriations does as well as what we do. So there'll be some overlap to that. And we may not take the lead on that one, because we have enough. So we'll see how that goes.
next is a report coming from the Agency of Human Services. This is a report regarding the agency's stakeholder engagement process regarding the all-payer model.
And next, there's a report coming in at the end of March. This comes from Act 45, the big child care bill that was enacted 2 years ago. And this looks at the difference between an enrollment-based model and an attendance-based model in the child care financial assistance program. So that's coming from DCF.
Next is a report coming from the Agency of Human Services due in April. And this report is looking at whether the fiscal year 2023 provider rate increase is having an impact on reducing wait times and resources and improving staff vacancy rates in certain healthcare settings.
And can't follow along anymore. And then there is a report that comes from the developmental disabilities work that this committee did last year. This report has to do with a selection process and an implementation plan for pilot programs for individuals with developmental disabilities. We talked about this when we went through all of the acts, but there was money set aside to develop pilot programs, particularly aimed at housing for individuals with developmental disabilities and housing options. And so this plan for these pilot programs will be due in April. And then we have, so those are the reports that are coming to you while the legislature is anticipated to be meeting. And then there are some future reports that we just wanted to flag for you as out on the horizon coming to you after you adjourn or next year when you come back. So the first is a report of the Child, Youth, and Family Advocate. This was a new position in office that was created last year. The advocate was set to start January of this year, so not able to do an annual report yet, but next year will be the first annual report. Oops, here's next.
Next, you may recall when we did the bill overview from the last biennium that there was the addition of audio-only telephone health services. So the Department of Financial Regulation has a report due in December of 2023 on the delivery of healthcare services by audio-only telephone in 2022.
In the 2019 budget, there was a report requested, which was an evaluation of effectiveness of certain childcare related programs and expenditures in the fiscal year 2020 Budget Act. So that will be coming to you next January. There is also a statewide prevalence and incidence estimates of ALS. And this is an annual report, and this was this was enacted after last year's session, so July 1 of last year, and your first report will be January 15th of next year. And then lastly, an evaluation of early childhood workforce programs. Act 45, the child care bill, put a number of child care workforce programs in place. And this evaluation that's coming in 2025 is meant to look at how the funds were spent and how effective it was at pulling new providers into the child care system.
What's the logic, maybe it's in here, the logic of having a study that's 4 years out into the future about a topic which is relevant like now? Is there?
You want to answer that, or you want me to?
Well, I'll take a stab at it and you
Go
can,
ahead.
you can come correct me. So sometimes if we just have a report that's 1 year out, at that point, the money is just sort of trickling out the door and it hasn't really had much of an impact yet, especially on these workforce programs. It will take a couple years for folks to get through school and enter the workforce for there to be any measurable difference to take note of. So my guess is the General Assembly chose this date because they wanted to have time for the money to go out the door, for folks who are currently in school to take advantage of those benefits and get into the workforce and have a better picture. Do you have a different take?
No, I think that really, that says it well. Yeah. We need to have time to actually see some results. If you do it prematurely, you don't have the data, or you might have incomplete data.
A lot of times people think as soon as you pass a bill, the problem's gonna be
Well
solved.
I guess the issue of the childcare workforce itself, is that well documented? I mean, you may have in the
Yeah.
variety of reports,
Yeah.
We have a,
So, and you have a report from Let's Grow Kids, and we have testimony that we heard as we were going through Act 45 last year. So you can scroll back to the previous session and look at just search childcare, and a bunch of information will come up on the testimony that we heard. So
okay, very good.
there, yeah.
Thank you.
And we'll probably hear more, as we go through the child care bill, we'll have to have that reinforced. Where are we now? Or has it gotten worse, Other questions? So we have a lot of reports.
Mhm.
And I don't expect that everyone's going to read all of them, but you should take a minute to look at the ones that you're interested in, have questions about, the ones that have been submitted, particularly than the ones that are coming. Keep your eye on those. And then as we go through bills, or start to have bills on our agenda, as I said before, we'll try to remember to have you just go through some of these reports. The recommendations are important. The data that's there that supports the recommendations are important. That's it. Any other questions for Katie and Amber? Thank you. And you're going to update that when there's,
We will.
in all your free time.
In all of our free time, we will update it and we will ask Alex to switch out the documents.
Oh, that's good. Thank you.
Yeah.
You're
You're welcome.
I keep getting reports and they keep sending them, yeah. Okay, so Wendy Traxton is here.
They should be joined remotely by Sean Sheehan, so
Okay.
maybe in the waiting room where I can paint him that we're about to start.
Take your time, get set up. Is there,
Wonderful.
okay, is this a team effort?
It is, and
All
Sean's
right.
going to share the slides, as I wasn't quite sure how to maneuver that with.
Okay, yeah, we, you know, if you, in the future, if you have slides, you could come in and share them off of your computer if you want, or Alex can do it, however you want to do that.
Thank you, really appreciate it. For today, we'll have, Sean will be sharing them from his screen.
Okay, so for the record, why don't you introduce yourself and the topic, and then we'll let you take over.
Yes, thank you. For the record, my name is Wendy Trachton. I'm the Deputy Director of Healthcare Reform, which is in the Agency of Human Services. Today, we'll be talking about Act 183 of 2022, and providing a status update of healthcare workforce activities. I'm joined by my colleague, Sean Sheehan. Would you like to introduce yourself, Sean?
Hi, everyone. Sean Sheehan. I'm the Special Projects Director in the Agency of Human Services. And I do have the slide deck here. I've clicked the share screen. I don't know if permission needs to be given to me on that, or if.
Alex, does Sean have permission? Can you give him that?
He should have permission.
Okay.
Let's see. Yep, looks like it allowed me to click there. Are people? Yep, it says it's sharing that screen.
Yes, it is. Okay. Shall I get started?
Yes, please.
Thank you. Wonderful. Well, thank you for having us here today. I did want to note that staff are actively working on healthcare activities authorized in Act 183 of 2022. These grant opportunities utilize federal state fiscal recovery funds, which we have are very now familiar, have strict rules associated with their allowable use, and have had a considerable learning curve for staff implementing the programs. We have been well supported by the Agency of Administration in helping us determine how appropriated funds can be used to both meet legislative intent and allowable uses of SFR funds as described in Treasury rules. I'm going to walk through each section with you and provide an update on those programs.
And probably given the time, you know, think about the level, maybe 2,000, 3,000 up.
Okay.
So yeah, we don't go into the details. We can always come back to that, where folks can read the specific information. This committee spent a significant amount of time on this work last year.
Then I will try to assume some knowledge of the different sections and get into where we are at, but I'm happy to dive further into anything that you have questions on. So Section 20 appropriates $2 million for emergency interim grants to Vermont's nursing schools over 3 years to increase compensation for faculty and staff. The Vermont Department of Health has determined the program parameters using SFR funds and is currently collaborating with the Vermont nursing schools to determine if the schools can meet the funding source requirements. So the schools would need to be able to fit into what's allowable under those rules. The next steps are going to be identified when this assessment is completed. Section 21 appropriates $400,000 for incentive grants to nurses employed by critical access hospitals in Vermont for serving as preceptors for nursing students enrolled in Vermont nursing programs. At AHS, we've defined those program parameters based on the Treasury guidance for SFR. These are the ones that align with the premium pay section of the final rule. We have contracted with an independent entity to support our program administration, which includes ensuring all our guidance and materials support compliance with federal and state requirements and will enable the state to successfully complete our Treasury reporting. We've really learned a considerable amount in this area since this is a premium pay program, as we've been implementing the premium pay for workforce recruitment and retention program. This is one we are really near completion and getting out the door. We anticipate being able to release this funding opportunity within the next month.
Okay.
Yes, I'm very excited about that as well. Section 21 requires the Director of Healthcare Reform or designee in AHS to convene a working group of stakeholders to identify ways to increase clinical placement opportunities, establish sustainable funding models for compensating nurses as preceptors, or hiring additional nurses to alleviate on preceptors or both and develop an action plan for expanding clinical placement opportunities. This working group has initiated meetings. They've identified near-term and longer-term potential opportunities for statewide inventory of clinical placement opportunities. They're going to continue to meet to consider sustainable funding models to support the staff necessary to ensure robust clinical placement opportunities for nursing students in Vermont. You probably have just heard this, but the working group did submit an action plan to the legislature with concrete recommendations that is now available. Section 22 is a $2.5 million program for the healthcare employer nursing pipeline and apprenticeship program. This provides grants to healthcare employers to establish or expand partnerships with Vermont nursing schools and to create nursing pipeline or apprenticeship programs or both that will train members of the healthcare employer's existing staff, including personal care attendants, licensed nursing assistants, and licensed practical nurses to become higher level nursing professionals. This is an area, again, where AHS has defined program parameters based on Treasury guidance for state fiscal recovery funds. And the contractor I noted before is also supporting this program in implementation and administration. In this case, although there's an actionable step forwards, the program parameters are in some ways inconsistent with the legislative intent for program design. And AHS is exploring options available to meet the intent. And I can talk to you about what those options are. So we are going to roll out a program that enables healthcare employers' existing staff to become higher level nursing professionals by supporting tuition and fees. That is an allowable use of funding within this funding source. We have submitted a BAA request that is linked here within this deck, which seeks to also provide support to these same staff for their living costs, which would, we would do this by using remaining funds from the premium pay program, which would then allow us to add a more flexible funding source to this grant program. We expect to issue this grant opportunity this quarter. And what we would need to do sequencing wise would be to implement the initial tuition and fees and issue then additional grants for living costs as soon as possible if the BAA request is approved. We're looking for ways for gaining efficiencies in the grant application process given this timing and sequencing. And we do expect that this additional funding would need to be issued through separate grant agreements to enable our treasury reporting.
I'm just wondering if the list of potential partners, if you've met with them yet, or just as an example, I was talking to the Federally Qualified Health Center in my area, and I don't think they'd ever been asked to have a nurse student with them. And I'm wondering how you're reaching out to these potential partners just to make sure they are asked.
In terms of apply for funding within this program?
Yeah, and to see if they want to participate. And it seems like there are willing partners out there that maybe have never been asked.
Yes, so we have
Good question.
We do have a great resource in the Healthcare Workforce Advisory Committee. So that group is going to be meeting again in early February, and we'll be working with that group on the outreach strategy. For some of our other programs, we've been able to take provider lists or from the Division of Licensing and Protection, using those lists to really be able to push out communications, letting people know about these funding opportunities. I think in this case, we'll be really looking for a partnership with trade associations too, to be getting the word out that this is an opportunity that we really hope everyone will take advantage of.
Okay, so like the FQHCs just in general or whatever organization, the parent organization could be the grantee, and then the sub grantees or whatever could be the on the ground frontline organization, right?
So for this one, the Healthcare Employer Nursing Pipeline and Apprenticeship Program, the grant would go to the employer, the FQHC, and they would administer the funding to get the tuition and fees paid for for their staff, for their existing staff members.
I'm just curious, I'm just worried about the extra administrative burden for like a little, very, very busy healthcare provider. Making sure they're not saying no just because they don't have the capacity to administer a grant.
So what helpful for this is we're inviting the FQHCs in next week.
Okay.
So we'll be able to ask that question. It's a good question.
Okay,
How
thanks.
it's gonna show how it works.
Appreciate it. And we're at a great time in program development to learn from that too. So
Great.
I'd be listening in to see what we hear and reaching out as well. So section 32 appropriate 750,000 as funds for full-time FTE to establish and operate a statewide healthcare workforce data center. We have submitted this position for classification and hope to begin recruiting soon. In addition, there's another one classified 3-year limited service healthcare workforce coordinator position to support these initiatives. And
What's the intent of the workforce data center? I mean, what's the goal?
We've identified within the healthcare workforce strategic plan a significant need for understanding the workforce current status, how all of these initiatives impact workforce moving forward. And we just have not had a single location where this data has been brought together to really help for policy development and evaluation.
Sure, you can do a market analysis and then do the analysis and make recommendations.
Yeah, so we can see how our workforce is doing, because we all know and hear anecdotes and real data about the challenges in our system, and we really need to be tracking that better.
Thank
you. Yeah. So the other position, which is the coordinator, that position is posted and is currently being recruited. And section 29E appropriates 1.25 million for the designated and specialized service agencies to fund loan repayment and tuition assistance to promote the recruitment and retention of high quality mental health and substance use disorder treatment professionals available to Vermont residents in need of their services. We have in this area as well defined program parameters based on Treasury guidance for those funds that align with what is called the behavioral healthcare section of the Treasury rule. Modification. So currently the Vermont Department of Health is administering a similar program to this. Some modifications will be needed to the current grant programming to align with this funding source. So we're working collaboratively with the Vermont Department of Health and the Department of Mental Health to update program guidance and develop grant application materials.
No, this is a really good place to talk about the lag time that Senator Weeks was asking about earlier. Because all the federal dollars that are coming in, as well as state dollars, take time to align that, put it into a system for grants and others, and it gets really frustrating if you're out in the community waiting for that to land. And it does take time. And we just hope we can do it as quickly as possible. We understand, I mean, have to understand.
Yes.
Somehow.
I mentioned the premium pay program and how the BAA request aligns with that. So if we have time, I can provide you an update with that program and how this. Sean, could you move to the next slide? So this is actually a program authorized under Act 83 of 2022, but it uses also state fiscal recovery funds and a similar rule that we are using for the nurse preceptor program. So this program allocated $60 million for certain healthcare and social service employers to provide premium pay for workforce recruitment and retention. It had a mix of funding sources. Those grant awardees received $2,000 per full-time equivalent employee. So out of the in the first round, 140 applicants qualified and were awarded $33.1 million in funds. 23 million of these were using HCBS FMAP funds. Those are funds through a special federal program where we received enhanced FMAP. and 10 million were used for using these SFR funds. So we provided an opportunity for those organizations who applied to elect to receive quarterly reimbursements or to receive the payment in full and disperse that over 90 days. There's about a 50-50 split. We're collecting data. We just received January reports to evaluate if we're seeing progress as a result of these disbursements. And we will have another reporting period in July. We anticipate accepting round 2 applications very soon in early February. The new eligible employer types will include primary care practices, dental offices or facilities, therapeutic community residences that did not receive funding in round 1, and high-tech independent home nursing providers.
Thank you, Chair. I was really fortunate yesterday. I got to tour Howard Mental Health on Pine Street, the Baird Center. It was great, but they shared with me that they have 400 job openings, so 400 positions that aren't filled. But I'm just wondering, as we're talking about workforce development, is housing being considered when you are, I mean, you've got money for workforce, but if the workforce can't find housing, how is that? I'm just wondering about the efficacy of a program like this, and if you're working at all on housing sort of behind the scenes.
With this program, we don't have funding for housing as a component of it. I will note, and I think this is part of our discussion where I said we're looking for additional, we are looking through the recommended budget adjustment act to be able to use any funds that would be remaining after the second round of this program to add this more flexible funding source that could cover living costs for the nursing pipeline and apprenticeship program.
Great.
So that would be existing staff looking to increase their nursing skills and would hopefully allow the employers to meet many of those social needs such as housing or childcare.
Yeah, thank you. And there was in no way a critique. It was just sort of like all of these things are so connected to each other that it just begs the question, like, how can you do this if you can't do this? So
they are. We shared your opinion when we were trying to work on how are we going to roll out. We really wanted to get dollars out the door, but everyone we talked to said tuition and fees are great, but we really need to support people in continuing with their education, and the living costs are an important part of that and haven't often been available. So we're very hopeful to be able to include that component in the grant program.
thank you.
And just for clarity, on the last slide, the second bullet about 33.1 million going out to roughly 140 applicants. So that's to the health center, the nursing home providers, et cetera. That's not a per person grant.
The way that grant works is that there's a consistent way of calculating the grant award where we have a way of measuring what is the full-time equivalent at that organization. We then awarded those organizations $2,000 per full-time equivalent employee. The employer then had the discretion in how to spend those funds to the extent that they had to spend those dollars on premium pay for employees that met the eligibility criteria.
I just want to note for Senator Gulick and others, last year we passed two major bills. Well, we passed a lot of major bills, but one was on workforce, and this was included in the big workforce bill. And then there was another really big bill on housing that included housing programs. So to the extent that they're not able to provide housing support, it is somewhat being done through this other bill. And there's more to do in all of this, but we did do two major bills, and they were administered by separate agencies and departments depending on their jurisdictions.
Workforce has come into play in our ed committee as well, so yeah.
Oh,
Yeah, it's kind of all over the place.
Yeah, so, and just to add to that, we don't need to go fully into it all, but we did work with education, and we did work with economic development as we developed the bill. And one of the things that happened a couple of sessions ago was inviting the Vermont Housing and Conservation Board in here and suggesting that there be some funds devoted to therapeutic community residences or the development of subacute beds and step-down beds, so that some of the housing dollars could benefit not just patients, but also workforce. And I think that's happening more. We're letting it happen. We're going to make sure that it happens as we go forward. It's not in this report.
And I feel like I sort of addressed this through your question, which is nicely fit right in here, but the BAA request includes adding funding to that $400,000 program for the nurse preceptor program that is right now available to, will shortly be available to critical access hospitals. So that's how that would be expanded. And I mentioned before, the other one would be covering the living costs. So it'd be extending the types of dollars that could be expended and the amount of funding available. So we should have updates on the available funding in April or May, which would then allow us, if the BAA passes, to roll out those second sets of grant awards for those applicants.
Terrific. Thank you. There's a lot here, and obviously going to have to go through, click on some of the plan that you have in here. This is the BAA that's in here. We're looking through and approach, but thank you. Questions? Go ahead.
Thank you. We had a good assembly yesterday at the Rutland Medical Center for Rutland Medical Alliance, and the same issues came up. Labor force, manpower, et cetera, constant theme from all the different providers. But what I'm seeing is that we seem to be all trying to draw from the same pool, whether it's Vermont, New Hampshire, New York, et cetera. And while the initiatives are very good about supporting the medical community, it's obviously critical, especially post-pandemic and looking forward. But what I don't see is how we're trying to address the current gap in medical providers or support staff. And I'm wondering where we think the long range solution is going to be with ensuring that the medical community is properly staffed. And one of the easy solutions, or one of the solutions that's been offered a number of times, is increasing visas for foreign workers to come in, not necessarily for citizenship, leading to citizenship, but to fill the gap. I'm wondering where that discussion is.
Funny she should mention.
Yeah, we actually worked on that last year. There was a little group of us that tried to come up with a solution for sort of like maybe a guest nursing program or something. And it is extremely complicated. And one of the things that actually came out of that was the position that was mentioned that the Department of Vermont Health Access, I think, has the workforce position. Is that in your shop? Yeah, in AHS, to sort of look at issues of those complicated issues that are required for a program like that. There's a lot of stuff about language acquisition, licensing, credentialing, immigration documentation, all this stuff. It got to be super complicated. So I think it's a worthy thing to look at. I was on a lot of Zoom calls about it at 7 a.m. And that's why we created that position, because just nobody had the bandwidth to deal with all of the complexities.
Okay. So in that position is currently it's being advertised.
Yes, the coordinator, which is related to these activities, and the strategic plan, so the one you mentioned, is currently posted on our website.
So it's a couple months out for you to be hitting the ground.
Yeah.
Mm-hmm.
Yeah, and the position would look at other things too, other kind of workforce things, but that was really what we started to look at. We're like, whoa, this is too complicated for us to.
And it's been something that's been going on for a long time. So it's important to finally wrap our arms around it now that we're in this place of significant need. I did want to, I think you had something else you wanted to share with us, but I did meet with a member of the Vermont Business Roundtable the other day about their work on the apprenticeship. If you've seen the work that they've done.
Yes.
Okay, and knowing that one of the areas of concern are the LPNs and our CTE folks. I know that the education committee is looking at that a little bit, but we may also be engaged in that. And then the need for nursing instructors is a continuing issue. So from the very bottom to the very top of the nursing hierarchy or pyramid. So everything right now is, when we're trying to turn the Titanic, maybe we need to do something different.
We've had the opportunity to meet with, I believe that's probably from Marianne Sheehan,
Yes.
to learn about the great work that she's been doing and meet with our contractors so we can leverage to the extent that the funding stream allows us lessons that she's been learning with her group.
Did you want to share something further? We have about 7 minutes.
I did finish, it was the premium pay information that I
Yeah.
was sort of added, so I don't have anything further to share at this time.
Okay, but this is great. This is good. This is the beginning. We'll be coming back to workforce. This is an ongoing need. I know that there are people here in the room who are very interested in this. And how can we get the money out the door? And how can we ensure that we have bottom to top incentives, loan repayment, tuition, etc. It's a never ending, and then the housing issue that course, and childcare. Oh, it all links in.
Thank you so much.
Okay, so we're good. We can go offline, Alec.